This snapshot shows that 1 in 31 children in the U.S. is currently diagnosed with autism spectrum disorder. The lifetime financial impact is staggering, with support costs for a single individual estimated between $1.4 and $2.4 million. But the economic data misses the daily reality inside the home. The physical and emotional weight of managing core symptoms falls directly on the shoulders of parents and caregivers. This chart from the Autism Parenting Stress Index, or APSI, measures stress specifically related to raising a child with autism. It shows that parents in the autism group exhibit stress levels 4 times higher than the typical control group. Effective clinical interventions must target the systemic stress fracturing the family unit, treating it as a primary obstacle alongside the child's behavioral symptoms. Up to 80% of children with autism suffer from severe sleep disturbances, including chronic insomnia, night wakings, and sleep anxiety. This lack of sleep directly impacts the glymphatic system. The glymphatic system is the brain's waste clearance network, a plumbing system that sweeps away metabolic toxins, but it only operates effectively during deep sleep. When sleep is disrupted, this clearance process stalls. The resulting buildup of toxins leads to neuroinflammation, which triggers the neurological dysregulation that manifests as non-compliant behavioral outbursts. This creates a closed biological loop. Poor sleep drives disruptive behavior. That behavior spikes parental stress, and the resulting home environment makes it harder for the child to settle, guaranteeing another cycle of poor sleep. To try and break this loop, researchers conducted a prospective case series using the ProNeuroLIGHT protocol. This is an at-home therapy utilizing photobiomodulation, a process which uses red and near-infrared light to stimulate cellular activity. This protocol uniquely applies light therapy to 2 locations at once, the child's head and directly to their abdomen. This diagram illustrates the gut-brain axis. Autistic individuals frequently suffer from microbial dysbiosis, a severe gut bacteria imbalance. Abdominal light energizes intestinal cells and rebalances the microbiome. This reduces pro-inflammatory signals to the brain, lowering neuroinflammation and preserving neurons. This dual-target approach addresses neurological symptoms from the top down and systemic inflammatory triggers from the bottom up. This slide outlines the 2 measurement tools used to track the study's success. Researchers use the HSQ-ASD to track the severity of the child's behavior and the APSI to measure the corresponding stress of the parents. Over the course of the study, the children's overall non-compliant behavior scores dropped by an average of 33 points. In parallel, parental stress scores dropped by 13.5 points. Notably, the specific stress related to the child's sleep problems fell from a serious rating down to nearly 0. This chart plots the severity score percentage change from baseline over 60 days of daily use. The trend line shows a consistent cumulative effect, with behavior severity decreasing by 0.281 percentage points for every single day the therapy was applied. Compared to historical data for existing interventions, these steady daily reductions represent a significant shift in symptom management. Concentrating light on a developing brain carries a specific biological risk, the potential to trigger an unintended immune response or aggravate existing neuroinflammation. This safety study on photobiomodulation shows the density of astrocytes and microglia, the brain's primary immune cells, remained perfectly normal after treatment. Furthermore, these line charts show no elevation in pro-inflammatory cytokines like IL-6 and TNF-alpha, which signal the immune system to ramp up inflammation. The data suggests that dual-target photobiomodulation is a safe intervention, acting as a biological shield rather than a stressor for developing brains. Reducing systemic inflammation allows the biological loop to run in reverse. Restored deep sleep enables the mitochondria to power the glymphatic system, clearing out accumulated brain waste and calming the nervous system. The objective here is the permanent disruption of a destructive physiological cycle. By addressing the root biological triggers of poor sleep and neuroinflammation, high-dose light therapy provides a mathematically proven frontier for families to reclaim their daily lives.